Welcome to the Mindray Demo Centre. In 2015, Zika virus broke out in Brazil. The disease was rapidly emerging in the Americas, Africa and the rest of the world. Since then, clinicians have paid more attention to the assessment of intracranial volume. The existing research shows that the size of fetal intracranial volume hasn't only important clinical value in the diagnosis of microcephaly, but also three other aspects. First, like fetal gestational age evaluation, ICV has a high correlation with GA, which can be used as an important index to evaluate fetal development. Secondly, assessment of IUGR. The intracranial volume of an IUGR fetus is significantly different from that of the normal fetus. Thirdly, as a common clinical parameter, fetal intracranial volume was integrated into prenatal-related clinical research. For example, fetal brain volume of pregnant women with diabetes is larger than normal. The reason for the regulation mechanism of this phenomenon can be inferred. At present, the commonly used clinical method is 2D ultrasonic measurement to evaluate the development of the brain. However, the 2D single section measurement is less accurate than 3D measurement. To avoid possible misdiagnosis caused by the examination, the 3D display can provide doctors with a more reliable basis for the diagnosis of abnormal intracranial volume. MRI and 3D manual vocal measurements are commonly used tools for 3D measurement of fetal ICV. MRI is considered as the golden standard in clinical measurement. However, due to its high cost, complex operation and factors of fetal movement, MRI has not been widely carried out in daily diagnosis. Conventional 3D vocal measurement is based on manually setting the reference axis and rotating to generate multiple 2D sections. Then users need to manually trace the 2D contour of the brain images one by one, and then fit the data to generate the final volume data. This method relies too much on manual operation, and the measurement error between different operators is large and time-consuming. In order to reduce the impact of these factors on the diagnosis, Mindray has developed a smart intracranial volume, Smart ICV. It is a fully automatic and accurate recognition system based on big data and advanced pattern recognition algorithms. Based on a large number of clinical sample data and pattern recognition algorithms, it can automatically recognize and calculate the fetal intracranial volume, which can assess the development of the skull more accurately. This figure shows the comparison between Smart ICV and MRI measurement results. The measured values are very close. Compared with traditional measurement methods, Smart ICV has the advantages of low examination cost, high accuracy and repeatability, real time and high efficiency. Let me now demonstrate the steps of using Smart ICV. The recommended gestational age of Smart ICV is 20 to 30 weeks. We are going to use the volume probe and select OB2 as the exam mode. The initial section can be positioned at the BPD section or cerebellum section. Click the 3D button, adjust the position and the size of the ROI box. Click Update on the control panel to activate 3D scanning. After 3D imaging, select SmartPlane's CNS on the touchscreen, under which we click the Smart ICV. The system can automatically display the 3D image of intracranial tissue and calculate its volume. Select Edit Item and then adjust or browse image layout through Win format. If you are not satisfied with the result, there are three editing methods to manually check the boundary and position of the enclosed line. Trace. Manual boundary tracing to adjust the position of the envelope curve. When tracing, please note, the system recognises that the area is cut out when the start and end points of the edit line are outside the enclosed line. The system recognises this area is added when the start and end points of the edit line are within the enclosed line. Smart Trace. The system automatically recognises the boundary. During the manual tracing process, the system automatically brings the traced line close to the tissue boundary. Control point. Drag the edit point to manually change the enclosed line. If you are satisfied with the measurement result, click Update VOI to accept the adjusted calculation results. Click Accept Result and the result will be displayed in the report. Under Smart ICV, you can also activate Shell function. There are 4 options in the drop-down menu: Off, Inside, Outside and Sim. You can also adjust the thickness of the shell by turning the shell thickness control, and adjust the section thickness by turning the thickness control. The volume data is displayed at the bottom left of the screen. You can observe the blood vessel distribution and blood supply in the shell area with Colour 3D mode. The following measurement indexes are shown as mg, mean grey value, percentage, the average value of grey in the segmented region; VI, vascularization index, percentage, the percentage of blood vessels in the segmented area; FI, flow index, percentage, the blood flow intensity in the segmented area; VFI, vascularization index, percentage, the mean value of blood flow in the segmented area. There are some suggestions on scanning. The scanning gestational week should be between 20 and 30 weeks. If the GA is too small, the fetal intracranial structure is not fully developed. If the GA is too large, the transparent compartment will disappear, and the fetal skull calcification in the 3rd trimester will also affect the observation of the intracranial structure. Before the 3D data acquisition, make sure that there is no acoustic shadow on the scanning plane. If the acoustic shadow is inevitable, the midline of the brain can be slightly raised to avoid the influence of acoustic shadows. To get 3D data on BPD section, it is suggested that the angle of midline should not exceed 40 degrees. Too much angle has a bad influence on accuracy. 3D ROI should be able to cover the whole skull. However, if ROI has covered some irrelevant structures, it will reduce the image resolution. Before the automatic calculation, ensure the quality of the 2D image and try to avoid the influence of acoustic shadow on the automatic measurement results. Smart ICV can also be used in conjunction with Smart Scene 3D automatic volume scanning technology. It realises full-stack intelligent scanning of the fetal brain and shows the entire process of 3D image acquisition, optimization and calculation, which greatly improves the diagnostic efficiency. Smart ICV, as an accurate and efficient tool, provides a more efficient method for the quantitative evaluation of fetal intracranial volume. The analysis of big data and sample of ICV are of great value for scientific research. It is not only suitable for clinical research, but also routine ultrasound examination. That's completed the introduction of Smart ICV. Thank you for listening.